My name is Amy Kelly, and I have 2 daughters and a son. My son Reese has Barrister Winter syndrome.
Reese is a dynamic 9-year-old boy with Barrister Winter syndrome and challenges similar to those patients with cerebral palsy.
He's very much a typical boy in the ideas of he likes cars, he likes being silly, he likes roughhousing, he likes watching girls scream.
Many children with cerebral palsy cannot verbally communicate.
He does like to tell jokes. He uses an iPad to communicate, and he does have a few jokes plugged in on there that he enjoys to tell his friends.
The problem with patients with cerebral palsy and other disorders is the excess salivation, and this can lead to a series of unfortunate issues. Number one, the worst being aspiration pneumonia with the potential for early death.
So yes, he was way more susceptible to illnesses and picking up germs and runny noses due to every little bug he could catch.
It certainly impairs their ability to socialize. Siblings not infrequently will withhold physical affection because the patients are wet.
Some of his peers were like, please don't drool on me, Reese. And they said it very kind and sweet, but it's not socially acceptable. It also is gross when you're eating and you have the kid sitting next to you or across from you who has saliva and food mixed in.
The family then looked at options. One option is to do nothing and continue to live with it. Number two is to take medications which dry up the saliva but also dry up your mouth. Third option is to have your salivary glands surgically removed. So the fourth option is to pursue a way to stop the saliva production with a minimally invasive technique, and that is salivary gland ablation.
Meeting Dr. Shields and trying these injections was something we were really excited to look into.
So we use a minimally invasive technique. There are no scars, no large dressings. We get into the salivary glands either with direct needle access under the chin or through the mouth with a small tube, and using X-ray guidance and ultrasound guidance, put in medications that will kill the salivary glands.
The first injections, we saw immediate difference within days. His drool was almost gone. Well, he's definitely more confident socially. He doesn't have people reminding him to suck it up all the time and wipe his chin, so that gives him more time to show his social personality and be silly. I think it's important for a child's self-esteem, first of all. It's important for other people. I think other people feel more comfortable around him and around when he's not drooling. They're more likely to give him the chance to see what he has to offer. No, you hit the wrong one. Your finger was too big on that one. What does Dad like to ride?